Hi, I'm Katy Milkman. I'm a professor at Wharton, and I co-direct the Behavior Change for Good initiative here at Penn. We are really excited to be co-sponsoring the launch of this new seminar series focused on behavioral science and health with our colleagues at the Center for Health Incentives and Behavioral Economics, also known as CHIBE. So this series is meant to explore the critical intersection between human behavior and public health. And I'm very lucky to be here with CHIBE's scientific director, Alison Buttenheim, who has the pleasure of introducing today's keynote seminar speaker and also a BCFG team scientist, Supreet Kaur. I'm going to pass
Thank
it
you,
to you.
Katie. And thanks everyone for joining us today. So this is the launch of this new series. We're hoping to dive deep into how behavioral science informs health outcomes, influences policy decisions, and drives innovations in healthcare delivery. So sort of CHIBE's core focus. We want to spark thought-provoking discussions and highlight real-world applications of behavioral science. CHIBE's particularly interested in how we go big, how we scale, how we implement. So hopefully that can be part of our conversation. We're delighted to be joined today by Dr. Supreet Kaur, Associate Professor of Economics at UC Berkeley. She is a development and behavioral economist, great combination. Dr. Kaur leverages psychological insights to explore poverty and labor markets. And today she's going to delve into the planning fallacy and savings behavior through a field experiment of seasonal hunger. So really interested to hear this. Let me just note to the audience, please pop questions into the Q&A that is enabled in our webinar function. We will be curating those and asking them during the Q&A. You can also upvote. So if you see another question that looks really great, upvote that and we'll get a signal about what's most popular. And with that, let me turn it over to Dr. Kaur.
Hi, everybody. Thank you so much for having me here today. I'm really thrilled to be here. It's such a great initiative and so many amazing insights coming out of this group. Let me share my screen. Okay, that working well? So today I'm going to present work on the planning fallacy and how it relates to savings behavior and seasonal hunger. This is joint work with Ned Augenblick, Kelsey Jack, Felix Masai, and Nick Swanson. And just to sort of motivate this, one of the things we see in a lot of different contexts are these like predictable recurrent cycles of consumption and expenditure. So concretely, here's an example from Zambia. So in Zambia, most people are farmers, and these farm households harvest they grow maize, they harvest their maize once a year, and then now they have like 90% of their income, and then they eat that maize down over the course of the year. And what this graph is plotting is that month by month of the year, what share of households report having a food shortage. And what you basically see is that right after when harvest happens, like around May, only 2% of households say that, we don't have enough to eat. But then by the time you get to the months right before the next harvest, for example, February, more than 50% of households are reporting a food shortage, that they don't have enough food to eat. And these kinds of cycles are apparent all throughout Sub-Saharan Africa, also in South Asia. They're just kind of pretty rampant. But this is not only a developing country problem. So in the US, you sort of see similar cyclicality month after month among food stamp recipients. So food stamp recipients receive their, benefits at the start of the month. And like by week 2 or 3 of the month, they've kind of exhausted their food stamps. And then the last week of the month, kids are going to school without eating breakfast. In general, like calories tend to drop. So not just like spending, but actual calories that people are eating tend to go down by 10 to 15% between the beginning to the end of the month. And this sort of follows more general savings patterns in the US. So, in surveys by the Pew Research Center of representative sample of Americans, if you just even look at like the share of Americans who say, I have no savings left, like I have nothing left on my bank account, it goes from 23% at the start of the month when people are receiving their paychecks to over half of Americans by the end of the month say, I have no savings whatsoever. And so you kind of see this cyclicality in lots of places. And so that's sort of this motivates our project. And when you go under the hood of this and try to, say, okay, well, why could this be happening? And of course, there's many, many reasons that contribute to this kind of cyclicality. One of the things you sort of see are patterns of beliefs among people that seem to suggest that this is not necessarily an intentional decision. People aren't necessarily intending to run out too soon before the next harvest or the end of the month. So this is data from a survey we did in Zambia, where we have these hungry seasons, and we went to farmers right after harvest, and we said to them, how much savings, you have this many bags of maize that you've harvested. If I come back in 3 months, how many bags of maize are you going to have left? So how much savings are you going to have left? And it's incentivized. So if you're right, I'll give you, some money. If you're roughly right, I'm going to give you some money. And so people give us a guess of how many bags of maize they think they're going to have in 3 months. And then we ask them, what's the worst case scenario? What if everything that could possibly go wrong actually goes wrong? How much will you have? And they give us like a lower number. And then we we go back 3 months later, and they actually have about half of, or about 81% of what they actually thought they were going to have. So this yellow bar is what they actually had. And so 65% of people actually end up with less maize or less savings than what they thought the worst case scenario was. And part of this seems to be coming from an overestimation of expenditures. So if you ask people, instead of how much savings will you have, how much are you going to need to spend on things other than food, like school fees and farm inputs and so on? And so these are not temptation goods, but really just like things you have to spend on for the most part. And you say, what are your total expenditures for the year? People give us a guess, and then when we actually measure expenditures over the course of the year, people are off by like by double. They actually spend double what they thought they were going to spend. So how should we think about why there's this bias in the beliefs could be coming from? So this is a problem with many pieces. Deciding what to consume or save requires some sense of like future inflows and outflows, how much income is coming in, how much is going out. And there's some expenses that are big and certain, like you have to pay for rent or you have to pay for school fees. But there's a ton of small, irregular, and rare ones. Like, you have to buy not just fertilizer, but also seeds. There might be like an emergency where my roof leaks and I have to repair it. My plow might break, my car might break down, and so on. And so people might know that these things can happen, but they might not really be thinking of them or have them top of mind when they're making this decision of how much money do I have to spend? Because what I can afford to spend today requires me to understand what I'm going to need to spend in the future. So you might remember the school fees, but not the textbooks. You might remember the fertilizer, but not the plow repair. You might remember that I usually have to pay this much for gas, but you might not remember I have a special trip to my sister's house in North Carolina in 2 weeks, and I'm going to need to spend a lot more gas driving there. So that, because of the nature of the budget problem, can create an asymmetric bias in perceptions. Because in general, for most people, even people with really volatile income is still pretty, there's like a few sources of income. Yeah, it can fluctuate, but it pales in comparison to how much more variable and volatile expenses are. There's just so many different expenses, so many different shocks. And so because of that, if you're more likely to forget things, this is going to create an asymmetry in the fact that expenses then are going to be more likely to be forgotten than income, just because there's so many of them and there's so many more rare ones of those. And so that can make you feel richer than you actually are. I don't remember I need to pay for this thing, so I think I have a bigger budget than I actually do to spend today. And that can create excess early spending. And that's really the idea that we want to test, because that would imply that if you just get people to think more structuredly about just what they already know about their expenses, remember the trip to North Carolina, remember that your plow might break down and so on, you might be able to change their beliefs and then as a result alter their behavior. And so we want to see, can that actually have an impact on people's actual savings behavior? So and actually, I can't see the time on my computer in full screen mode. Would somebody mind just giving me like a 15-minute heads up?
We're on it, no problem.
Thank you. So this relates to, I'll go through the literature very quickly. There's such a rich literature here, but just sort of to note, this relates to literature in economics about behavioral economics, about how cognitive constraints affect decision-making. And a lot of that is focused on things like ignore information in my environment. I might not see like the amount of taxes on the cigarette label. I might not notice like in the Hana et al. Paper, like what is in the, like I might not pay attention to what are the returns to planting in a certain way and so on. And there's work on kind of reminders, and if you remind people, that can kind of like change behavior. What we're doing, oops, okay, did not mean to do that. What we're doing is highlighting this fact that people just might not be relying on the information they have inside of their own heads to affect their decision making and behavior, and that broadens the scope for impacts of cognitive constraints. This relates to the huge literature and very robust literature in psychology on the planning fallacy, where the kind of hallmark of the planning fallacy is kind of those stylized facts I showed you, kind of over-optimism about the future, even though your own past experience would tell you that this is an over-optimistic view of how much savings you're going to have in the future. And then the planning fallacy literature has kind of given us a very robust set of tools for how you can then correct this fallacy by using kind of an unpacking thing where you kind of have people think through categories and through that kind of remember things that they might not already be remembering or take into account, and through that can kind of lead to more accurate beliefs. And we're building on that to sort of show that you can that this doesn't just change beliefs, we can actually really change behavior months down the line. And it kind of provides a potential micro foundation or complement to this work that, for example, Katy has done on just the act of making a plan can really make people more likely to follow through on their plans, and the plan and work that Abby Sussman and others have done on kind of bringing the idea of the planning fallacy into the budgeting problem. So we're kind of taking that and looking at this high stakes long run field behavior. And then this relates to the literature on consumption smoothing failures, and what we're just pointing out is another reason why you could have these failures and a policy tool you might be able to use then to solve them. So what do? So our goal is to help people think through their own planning problem in a more structured way through their own cognitive effort. And so we're going to adapt this idea from the planning fallacy, where if you think by category, it's going to increase retrieval. So for example, if you might not remember I have to pay for fertilizer, but if I ask you, what are you going to need to spend on farm inputs, you're more likely to remember fertilizer because it's easier to think associatively in categories. And that's kind of drawing on this idea from the memory literature. So what do? We, in Zambia, we design a very simple budget board where we take the major categories of spending over the course of the year that people are going to have. So this is like, so people have a bunch of maize. And so this is like how much maize you're going to eat in each month of the year. And then these are like the big categories of spending, like school fees, household goods, farm inputs, emergencies and shocks, and so on. And so we have these 7 categories, and we do this very tactile activity where people, they think of, okay, how many bags of maize do I have? And then we give them thumbtacks according to that many bags of maize, and they actually allocate their maize to these categories. And we do this, with the household head, and they do it on their own. And very importantly, we don't provide any assistance or coaching. We don't tell them what their plan should be. We just say, here are some thumbtacks, make what you think your plan should be for the year. And what you kind of see happening is people start on this side, they like put down what they think they can spend on different things, because food is such a necessity, it's kind of inelastic. You're going to need to eat a certain amount. And so then they put down what they're going to, spend on other things. And then by the time they then go to the food board to start filling it in, they've like run out of thumbtacks. And then they realize, oh crap, I'm like over optimistic about what I actually think I was going to be able to spend on these things. So then they go back and they reallocate and they pull some thumbtacks away and go over here. And so it kind of changes their perceptions of, in some sense, how rich they are. And so what we do is we, have a treatment group that's going to get a version of that exercise. For the control group, there's a little bit of a trade-off. We want to extract information like what's in their mind when making a decision, but just by asking people to think through things can also treat them in some sense. So what we're going to do is run 2 separate experiments. We're going to run a mechanism experiment that's really going to let us get really deep, like very precisely and cleanly at the mechanism we're interested in, but it's going to require contaminating the control group. And then we're going to run a field experiment, which is kind of like the at scale, what is the policy intervention you could run? Okay, so what do we do in the mechanism experiment? So the treatment group gets like the full, 6 categories of expenses plus food, like budget board. And then the placebo or control group gets just a simple 2-category budget board where it's just food and non-food. And we do the same thing where we give them thumbtacks and they allocate. So everybody goes through a planning exercise. The only difference is that these guys go through the more segmented one where there's more categories that are going to induce information retrieval. And what we think is going to happen is the allocation to non-food expenses is going to be higher under this this board than this board, because people are going to remember more expenses. So what do we find? So this is the control group. This is the treatment group. This is what share of their savings is allocated to non-food expenses. So, as you would expect for the treatment and control group going in, their prior is the same. So at baseline, what do you think you're going to spend is the same because it's an RCT and the 2 groups are similar. Then they get the board. So the control group gets the placebo board and the treatment groups gets this board. And we find is that the treatment group predicts having 42% more expenditures. They realize I actually need to spend more money than I thought I was going to need to. And so these are the CDFs of the 3 groups, and you can sort of see the treatment group is shifted to the right and how much they think they're going to need to spend. So we're changing kind of their expectations of future spending. Then we want to say, like, does that actually then matter for how poor you feel? Is going to change your consumption decisions or your spending decisions? So what we do is we test whether people have a reduced willingness to buy luxury or discretionary consumption items by offering them a set of items that are kind of, like a solar panel, radio, some clothing. So things that aren't necessarily something they need, but would be really great to have. And we elicit their willingness to pay for one of those 3 items. And this is very common in the setting. You have these like briefcase buyers that come through the village and they offer you goods like these and you buy it from them. So we kind of replicate that transaction. And what we find is that the people who got the placebo board are just much more willing to spend more money for a given consumption item than the treatment group. So the treatment group, the people who got the full board, are just like, you know what, I don't want to spend so much on a discretionary item. So it lowers their willingness to pay for discretionary consumption. So then what we do is, after we've done this exercise and we've gotten this information, we go back to the control group and we then give them now the 6-category board. So for the same person, they've done the 2-category board. Now I'm going to give them the full 6-category board. And now what you see is their beliefs about future spending look really similar to the treatment groups, as you would expect. Now they also are more realistic in what they expect. And now what this allows us to do is to look within person and say, what were the things you had forgotten? What were the expenses that you didn't take into account in the 2-category board, which you now are taking into account with the 6-category board? Because now, and that allows us to get a sense of what kinds of expenditures are being forgotten. And this is a regression table where the dependent variable is just, did you forget a particular expenditure? And here we're just taking features of the expenditures, and we have the households themselves label what kind of, like, is this an uncertain expenditure? How big is it? And so on. So we're getting the information from them. And we basically see is that people are just more likely, to, they're more likely to forget smaller things. So if it's bigger, you're less likely to forget it. They're more likely to forget uncertain, rare things like shocks. And that's kind of very consistent with what you would expect from the memory literature of what people are more likely to neglect or forget. Those are the things they're not accounting for when they think they're richer than they actually are. So now we want to know the impact of this on real spending behavior. So we undertake a longer field experiment with 837 households where they do this budget board, and then we track them over the course of the year. And we make 2 changes relative to the mechanism experiment to maximize the treatment effect. The first is, given our mechanism, like our idea that people are basically, this is like a, limited memory is one of the things that can underpin this planning fallacy sort of behavior. We worried that if we asked people about expenses, even the control group, like, allocate to the 2-category board, that could be a mini treatment. So we decided to keep the control group totally in the status quo. We gave them no budget board. In addition, our whole premise is that people, may not remember that this thing is coming down the pike. So even if our intervention prompts them to remember the fertilizer or the trip to North Carolina in 5 months, that's again may not be top of mind when they're making their spending decisions. So our solution was to memorialize the plan people gave by giving them labels that they put on their bags of maize. So these labels correspond to those categories. So, farm inputs. So if you decided I need 2 bags of maize for farm inputs, we would give you 2 labels that you could put on 2 bags of maize that say this is for farm inputs. And then, or for each month of the year, this is, how much maize I need for June, July, August, so on. And so these labels are attached, these labels are given to both treatment and control groups. You might start wondering, well, maybe your intervention is having an impact through self-control benefits, not through the planning fallacy or these changes in beliefs. And so to kind of deal with that, we do a few things. One is we offer these labels to both treatment and control groups. So if it's just about like the technology of having a commitment device or a mental accounting device, like to keep track of what you're spending on, that exists for both groups. The only difference is the treatment group is also getting the planning intervention. And also we only attach these labels 2 months after the budget exercise. So in the first 2 months, we can actually look at effects of just planning alone with no additional labels or anything. Okay. So what do we find? So what would we, in sort of what we predicted, one is, I've sort of shown you that people underestimate future expenditures and overestimate future savings. That kind of will come from this kind of mechanism. I've shown you the descriptive evidence of that. Immediately when you do this, we would expect what we saw with the mechanism experiment, that people beliefs change about how many expenses are coming down the pike, and their willingness to pay for discretionary consumption drops. So we're going to replicate what we did in the mechanism experiment, and we get exactly the same effects. So when we do in the field experiment, we see that treated households predict having 20 to 60% more expenditures than the control households, which is this green line. And so that kind of accounts for a lot of the forecast error for savings. And when we do the willingness to pay, treated households have a 34% lower willingness to pay for discretionary consumption items like that solar panel, the radio, the clothing. And so this is a replication of the effects with a completely different sample of households run in a different year. These 2 experiments were run in different years. So this is kind of a nice replication. But now we can kind of track these households for longer, right? That was the reason for the bigger sample size and the structure of the field experiment. So what we expect to happen in the long run is treated households should have like a flatter spending profile. They should have less spending in early months and more spending in later months. Um, and so um, and so what do we find? That is what we find. So first, let me focus on the figure over here to the right. What you sort of see is that, so this is the y-axis is weekly spending. So how much money did you spend in each week? And then this is like each month of over the course of the year. And what you sort of see is that the control group is spending a lot earlier on and then kind of declining pretty steeply by the end of the year. This is kind of that, like the food stamp behavior. You spend a lot early, or you eat more calories early and then you die down. What we've done is we've made the profiles flatter for the treatment households. The treatment households reduce their spending immediately in the first couple months. And again, these first couple months where all of the action on increased savings is coming from is before the labels went on. And now that they have more savings because they've spent less here, they're able to spend more later parts of the year. So we still see a decline for them, but we flattened it out a bit. And so in terms of the magnitudes of these effects, this is a regression table showing the treatment effect, comparing the effect for the treatment group relative to the control group at different points in time, because we show up like every couple months and measure their maze. And this is, and so what we see is that, 2 months after doing the planning intervention, before the labels have gone on, there's a 15% increase in savings. Then when we go back in starting right before the hungry season starts, there's a 20% increase in savings. The treated households still hold 20% more savings than the control households. That corresponds to 4 weeks worth of maize stocks. Like if you think of like how much does the control group spend in a month during the hungry season, this like the amount of savings these guys are going into the hungry season with is like a month's worth of expenditure. So it's a big effect. And then as you would kind of expect, now they have more and they can eat it down by the end of the year. The end of the hungry season, there's no difference because these guys have now been able to spend more during the hungry season, and they kind of all converge to zero as you would expect. You've like kind of eaten down your pie. You've just done it in a more patient way. So what are the implications of that? So they have more savings and they can spend it on stuff. The fact they can spend it on stuff, actually has not just implications for welfare, it also actually matters in the setting for productive investment. So because the higher savings post-harvest gives you more resources later in the year because you've saved up more and enter the hungry season with more money, you can do 2 things with that. The one is it might change what you decide to do with your labor, with where you work. So what happens in general for the control households is that they run out of maize too soon, but you need to eat. So what they do is instead of working on their own farms, they go get casual day labor jobs in the city or for other people in the village. And so instead of working on their land, they work for other people because they need to get money so that they can go buy maize in the market to eat, because people are going to not go hungry. There's a way to earn money to eat. So they're going to do that at the expense of working on their own land. And that matters because the returns to working on your own land are high because this is like the planting season for the next year.
I just want to jump in with your requested 15-minute clock warning.
Perfect.
And
Great.
also want to encourage everyone to follow Mia's lead and start putting some good questions in our Q&A.
Yeah.
Back to you.
Okay, thank you. And can you also give me a 5-minute heads up, Alison?
I sure can.
Thank you. So then, was there a question? No, okay. And so so the other thing it means, if you have more money in the hungry season, you can afford to buy things like fertilizer and pesticides and seeds and so on. So other kinds of inputs or hire labor to work on your land. Because again, because the hungry season coincides with like this really important time of year for when you're planting and working for towards the next harvest, it actually really matters to have money to be able to pour into your farm, both in the form of your own labor, but also in the form of like buying things for your farm. And so what we do is we use surveys to see like, does it change? Like, what are people spending on? And so this is like a massive table. So I'm going to walk you through column by column. So in column 1, first is like what's happening to food consumption. So they spend less early on and they enter the hungry season with more money. And we actually see, our measure of consumption is pretty crude. It's just meals per day. We actually don't have an intensive margin measure of like calories or like how big is the plate. So this is probably could be underestimating measures. But we see is we don't really see a lot of evidence. So this is like the effect in this column is the effect on like 2 months after the intervention, again, early parts of the hungry season, during the hungry season. And we don't see a lot of movement in food consumption. Maybe people are eating a little bit more, more meals like in the early parts of the hungry season. But part of, because we know from the setting from previous work, what's happening is to stabilize food consumption, people are just not working on their own land. They're going and generating money elsewhere so they can buy food. Where we do see big effects is on these productive investments. So in columns 2 to 3, what we're doing is looking at how many days of wage labor do you do for someone else, or how much are you making in terms of wage earnings. And what we see is that there's not a whole lot of change in the early months of the year, but because you enter the hungry season with more savings, you can use those savings, like your maize savings, to eat that maize. And that means they're less likely to, they work fewer days for someone else, like outside of their own farm. And as a, you know, and so they're less of their earnings is coming from outside of their farm, from wage labor. So they're not diverting time away from their farms to working for other people. And then we also see some suggestive evidence that they hire in a little bit more labor during the hungry season. They spend more on inputs like fertilizer and other chemicals, so that this is noisier. And so we have some suggestive increase that what they're doing is like investing more in their farms. And so as a result, what we see is a 9% increase in their crop revenue at the end of the year. And this is, you know, the p-value of this is like 0.06, 0.07, but you can measure in lots of different ways and different questions. And we kind of, if you ask them how many bags of maize did you harvest, what was your revenue? In all these cases, we see about this 9% increase in crop revenue. So that allows them to enter the next year with a bigger pie. So we see this big impact in savings that has this big impact for productive investment, and then how much food you're going to have going into the next year. So then what happens in the following year? What we find is like a year afterwards, we go back to households and we actually ask them, would you like this intervention again? And we actually ask them if they're willing to pay for this intervention. And 90% of the treated households are willing to pay us to get this intervention a second time around. And 75% are willing to pay at least as much as a bag of sugar, so it's just to kind of benchmark what that is. That's like a reasonable amount of money for these guys. And so it's not like they want to avoid this. It's not, so we interpret this as inconsistent with like motivated reasoning. The reason I don't think about future expenses is because it makes me sad. They like eagerly want to undertake this exercise, but they, you know, and they value this as almost like a cognitive tool to do so. 95% of individuals also say that labels would not be helpful if they hadn't received the planning intervention first. So it does seem like that intervention itself, just like it is in other applications of the planning fallacy literature, is super helpful in this setting. Okay, so let me do a few, 2 sets of extensions and then I'll conclude. And the first is, you know, there are like, why is it people don't learn? People have had experienced a hungry season every single year for decades. And so these are very experienced agents. Why is it that they're still over optimistic about their future savings? And so the first thing we can do is just say, do people learn from experience? So here, we're just looking at that forecast error of like, how much savings do you think you're going to have in the future and how much you actually have? And we're just plotting different groups based on their age. So this is like the bottom quartile, and this is sorry, this is like these are the young people and these are the older people. And so what you sort of see is that among the younger people, 85% of them were over optimistic about how much savings they'd have in the future. But even people who are 62 years old, so have had like 4 decades of being the household head, 73% of them are over optimistic. So people are just not really learning from experience, which is consistent with the planning fallacy again. So what we do is we actually try to understand why. And so one of the things we do is when we go back in this year 2, we actually ask people to remember how much maize they had during the hungry season, or during a point in time of the year. So we actually said, you know, in September 1st of last year, how much maize do you think you had? Or in August 1st of last year, how much maize do you think you had left? And that was like corresponds to the date we arrived to do this like incentivized thing of measuring your maize. And we vary the incentives for that. If you're right, you either get like a day's worth of wages or a 4 days worth of wages. So it's like a sizable amount of money if you were like roughly right. And we find is that most people have an overly rosy memory of the past. 71% of people recall having more savings in the past than they actually do. And that actually explains 80% of the forecast error. And so, and there's no change with higher incentives. So these 2 lines are the CDF for like the, you know, high versus low incentives. They sit on top of each other. So it's not like people are like wanting to lie, and if you give them more money, they become more accurate. They really just think that the past was better than it was. And so if you have this overly rosy memory of the past, it's going to dampen your ability to learn from the past. So then the final thing I want to do is just think about external validity. So this is a field experiment from Zambia, but I started this motivation with like the food stamp evidence from the US. And so is this a more broadly generalizable phenomenon? And so what we're going to do is we conduct a survey on prolific for households that make $20 to $70,000 per year. And so these are people who are employed or not living with their parents, so they're making some financial decisions for their household. So we do this with about 700 people. And this is like a very simple online survey with a very crude interface. So there's a large scope for improvement, but even with this, can we actually do something on beliefs is what we wanted to test. So before I go to that, you first just do some survey questions. So do people mispredict upcoming expenses? So what we're plotting here is we gave some people two different kinds of statements. We randomized. Some people got the statement, how strongly do you agree or disagree, or how often does the following happen? There are months where more expenses come up than I had initially expected, and those are the red bars here. And almost everybody is saying, sometimes, often, always. So no one's saying, no, it never happens that more expenses come up than I expected. Instead, if you ask people, there are months where fewer expenses come up than I expected, everyone says, no, that never happens. I never have less expenses than I expected. So there's this asymmetry where people are always surprised in the wrong direction. Like they always are getting hit with more expenses than they thought they were going to. And so that's consistent with the systematic underappreciation of like expenses. And we actually don't see this for income. So when you do the same thing for income, people are pretty good at predicting their income. They're really, really over-optimistic about their expenses. Then we actually ask people, we just see, can we use a segmentation exercise just like we did for in Zambia with this sample to improve their accuracy of their expenses. So we asked people, what is your best guess of how much money you will spend in April? So we did this in like the end of March or the beginning of April. And then we said, what is your best guess of how much money you will receive? Like, what is your total income? So we elicit initial prior on income and expenses. And then we have them do kind of the segmentation exercise where have them go through the different categories of expenses and break them up into categories, and they go down. And we do a similar thing for income. We have them go through category by category, the different sources of income, and have it break it down. And we look at the totals. And so this is the CDF of expenses. So this is the 0% change. And this is saying what fraction of people are above zero. So as you can see, about 60% of people, when they go from the prior to what happens after the segmentation exercise, revise upward their estimation of expenses. And the mean change is 30%. So most people are, hardly anybody's revising down. Most people were over-optimistic in their initial guess, and they revise their expenses upward. And 70% of respondents say that forgetting expenses was an important or very important reason for the discrepancy between why their prior was so much lower than like the actual amount of expenses they compute when they actually go through a category by category. Now, instead, when you do it for income, we 32% revise upward, but so it's a much smaller share, but really the mode, like almost 60% of people, there's no change. They were spot on. They knew exactly what income they were going to have, and it didn't change after unpacking, and the mean change is smaller. So you can really just see there is this asymmetry where people are much more likely to be over-optimistic about expenses and much more likely to be accurate about income. And if you put those two things together in the beginning of the month, you're going to think I have more money to spend today than I actually do because I'm forgetting how much I need to spend this month. And so then when the end of the month comes, I'll have overspent early in the month, and I'll be, out of savings at the end of the month, and my calories will drop, or my spending will drop. Okay, so in this, so overall, what we think, the planning fallacy initially has really been applied to time allocation problems, and people like Abby Sussman and others have brought into the budget domain. But more broadly, we think this idea of what we're thinking of is a particular, perhaps micro foundation rooted in memory that can give rise to the planning fallacy. And in general, there's many important problems that require pulling together many pieces of information, from your head. So savings, if you're a micro entrepreneur ordering inventory and you need to know, like, how much of this thing can I order this much bread, but is actually I'm going to need to save some money for like something else that's coming down the pike. Or a school teacher who's like, teaching a lesson, and the kids, when I'm doing fractions, seem a little confused. Can I afford to spend an extra 2 days on fraction? Am I thinking about what are all the other things I need to cover? And so am I going to overspend time now and then run out of time for completing the rest of my syllabus? So you can imagine.
Just give it your 5 minutes.
Okay, thank you. I'm doing great. So so as you can see, this sort of problem just could come up in lots and lots of ways. So and our thesis was that people just can't do this perfectly, like pull all this information that you have in your head but isn't really top of mind and pull it together. And so like these pieces are in your head, but not in your mind as you're making the decision. And that considerably broadens the scope for people to misoptimize even at really high stakes, like your annual consumption smoothing problem and how much you're going to invest in your farm, which determines your whole year's income for the next year. And so our project really used this like 30 to 45-minute intervention to retrieve known information via these categories to sort of use the segmentation effect sort of exercise. And we see a 15% increase in savings over the next 2 months. Households enter the hungry season with a month more worth of savings, and this improved investment leads crop revenue to go up by 9%. And so this, you know, in addition to kind of then the research or academic side of it, this also just provides a very feasible policy intervention. And in fact, before we did this paper in Zambia, one of our co-authors, Kelsey Jack, had done a different paper in the same setting during the hungry season, where they just gave people money, like cash grants during the hungry season. And she saw really similar patterns. They like didn't work on other people's farms. They worked more on their own farms, and their yields go up. And the amount of effects we see just from doing this simple, psychological intervention are just as big as the impact of actually giving people like 2 full bags of maize, which is like a huge, as you saw, like people had about 10 bags of maize on average when we started after harvest, like, a few months after harvest, this exercise. So like it was a huge amount of money, and we get similar effects on these outcomes just from doing this exercise at a small fraction of the cost. And so this is giving us a potential policy intervention, which we can then take and scale up. And in fact, we are scaling it up right now. So kind of with a nod to Alison's comment in the beginning about caring about scale. So we're actually working with One Acre Fund right now to scale this up in Malawi, which is not too far from Zambia, but it has a much more complex and diverse sort of income set. People have lots of different income sources. Money comes in at different times of the year, and we're working with them to scale this up. We just finished the pilot, and now next year we're scaling it up across the country, evaluating it via a randomized trial, and if that's successful, they'll scale it up across all 9 of their countries in Africa. And then we're also exploring other paths to scale, like embedding it in cash transfer programs, looking at the US context, and so on. And that's also something I'm really happy to talk about during the Q&A. Right. Well, I'll stop there, and it seems like we'll maybe have a little bit of extra time for questions, which is great.
Fantastic. Thank you so much. You've gotten a lot of questions coming in, so we'll have a really good discussion there. We did promise a joke, which we didn't have ready at the beginning, but thanks to ChatGPT, we do. So Supreet, give you a chance to breathe, and I will say to Katy Milkman, knock, knock.
Who's there?
Planning fallacy.
Planning fallacy who?
Planning fallacy, you thought this joke would be over by now, didn't you? Surprise! We've got 3 more knock knocks to go.
Not bad,
That's
not bad. Okay, into the questions. Hopefully that gave you a moment to recuperate from an absolutely outstanding talk, Supreet. We got a couple of questions about the choice of 6 versus 2 categories for your manipulation, or of course, 6 versus none. And one person pointed out that they thought maybe the response about total expenditures would be nonlinear in how many categories, and maybe there could be too many categories. Another person wanted to know how you chose that and if there was prototyping involved. So maybe you could answer those together and sort of tell us how you ended up with 6, and if your theory would differ if you'd gone with 8, 10, 4, etc.
Yeah. So those are 2 great questions. So on the first one is why did we choose the amount we did? This was really based on piloting and intuition. Like the budget board looks so simple when you look at it, but I think it took us like 6 months of work in the field to like arrive at it. And part of it is you want it to be helpful for people. You want to leverage the insights from the planning fallacy, where if you break things into categories, you remember more things and so on. But you also want it to be cognitively tractable for people. Like if it's just a pain to do it, and if it takes like a long time to do, people are going to kind of mentally check out, because you could ask someone to come and sit and do it with you, but they have to be willing to engage and actually do it for it to be meaningful for themselves. So there was this trade-off between hitting the things that were important but not being too onerous. And also we didn't want to get the categories to be too fine because it was very important to us that we were not guiding people on what to pick. So if we had gotten really, really, really extreme, so instead of just emergencies, we had hospital visits and, or, instead of just farm inputs, we had, maybe it's a better example, fertilizer, seeds, hiring other labor, plow repair. Like if we had all of these things, irrigation, you might worry that maybe we're giving people guidance on what, like their interpretation of what we think we want them to spend on. So instead we put categories that were big enough that like everybody would definitely have expenditures in those. So that's kind of, those were the reasons for that choice. In terms of like, what would have happened if we had more and more, of course, we don't know that because we didn't do it. But I think that, in general, the memory literature would say, or work we have in psychology and economics would say, if you do keep giving more and more categories, actually the number will get bigger and bigger. And it might be that you get them to think it's too big because you've given them so many fine categories. And that's especially true if it's like in the shocks where it's like rare shocks. If you say to somebody, what's the probability of a hurricane? What's the probability of, and you go through all these small things, you can aggregate up to something that's like too big. And that's a reason then to not go into such small detail, because even with this, people still ended up undershooting in terms of what they thought they were going to spend and what they actually spend. So we got people much closer to the truth, but like 60 to 80% closer, not 100% to the truth. And so again, by picking these big categories that everybody would definitely have spending on, that kind of helped with that. But it's an interesting question to actually map that out. And it's something one could easily do, even on Prolific, for example.
Great. That's great. I'm going to say one more thing and then I'm passing the baton because
Yeah.
Alison and I get to take turns picking questions we're excited to ask. One suggestion we just got was that maybe we should close the screen share or the slide share just so everyone
Sorry.
can see our beautiful faces in larger format.
Great
Okay.
idea. Thank you.
Thank you, Supreet.
Yeah,
That's a great question. Great answer.
I'm going to go with the People's Choice question, which is the one that got the most upvotes, which is a really pragmatic question around recruitment. How did your team recruit the households in Zambia to participate? Were there partnerships that you leveraged? Sort of a unique study to participate in. How did you get folks in the door?
Yeah, great question. So what we did in this case was, for the academic study, the initial one, we just went to a part of Zambia in Eastern Province, which is like the poorest part of the country. And because we knew we wanted it to be this thing where you are allocating amounts, there's a part of the country where people just store their maize in 50-kilogram bags, so you harvest and it's like all this maize, and other people store it in granaries. So we said, okay, let's just go to the part of it where they do it in bags. So that's kind of a technological thing. That seems like now increasingly that's how everybody does it in Malawi. So I don't think that's necessarily so restrictive. But other than that, we just basically went away from the city centers. We went to a village. We talked to the village chief and we enrolled participants. So we actually just did kind of a convenient sample. And then within, when we got to a village, what we actually did is we just, the village chief, we had a roster from them of like who are the households in the village. And we just said, we don't want the super rich guys and we don't want the really, really poor guys that just don't even have enough. If you have like 4 bags of maize, you just really can't engage in a meaningful planning exercise. And so we took like the 80% of the village that's in between, who are all still pretty poor. And then among those, we just randomly picked people. We were just careful to pick a small set of people in each village because we didn't want to have a lot of spillovers between the treatment and control group. So we never had more than 10 people in a village. So this wasn't very heavily selected on any particular domain. And we just had a budget for how many people we could reach, like about 800. And we just kind of enrolled villages until we got to that amount.
Great detail. Thank you.
I'm going to go with another practical question about a spillover effect that we have a curious audience member wondering if you looked at any effects on child labor and whether child labor might have shifted relative to the control group.
Yeah, it's a great question. We actually might, I don't know it off the top of my head because we did ask about kind of everybody in the household. I think that it could have, in the sense that, and it depends on what you define as child labor. In this setting, working at 15 is not child labor, unfortunately. And so I think the expectation would be that probably did shift rather than, but it's not clear to me if some of that didn't get put back into your own farm. But it's something we could look at. It's an interesting suggestion. We can look at that.
I'm actually teaching scarcity theory tonight, so I'm going to scarcity mindset. I'm going to go with a question around how like the cognitive load of poverty and insecurity and scarcity mindset fits into this work.
Yeah, it's a great question. So I think that there, you know, I see this as a distinct mechanism in the following sense, but I think but having kind of increased cognitive load would just make this harder, or because if you have less bandwidth, you're more likely to then, not have the things on top of mind that are coming down the pike. So, remember our theory is there's like because of the limits of human memory, anybody is going to forget that small trip to North Carolina and not count for it, right, when they're thinking of there. But then if you're like super stressed out about how you're going to pay rent or whatever, that is just going to make it more likely that maybe you don't have the just cognitive bandwidth to think through all of those additional things that are coming down the pike. And so that might make you more prone to this, which is, I think, really interesting to think about that interaction. We, I think, don't have enough variation in like wealth in our sample to really look at that meaningfully. When we did look, we didn't see strong evidence of variation by like baseline harvest sizes, which might mean that, this is there for everybody, or it might mean that, maybe it's pretty similar regardless.
But there was no additional manipulation to increase that for some people through some. Okay.
No, there wasn't.
Another really interesting question about possible additional variable you may or may not have measured. Question is about whether or not you looked at the emotional impact of the intervention, and the theory was possibly the intervention will actually cause negative emotions because now you're killing over optimism, which is kind of interesting question. Maybe it's good for you financially, but bad for you emotionally.
Yeah,
Do you engage on that?
Yeah, totally. I think, and this is the, I think this is the, and we didn't have a strong prior going in, for, on this. And you could imagine, I mean, I think even going in, we kind of had a sense that maybe why this happens, like, because the planning fallacy is just a statistical or empirical stylized fact that people are over optimistic. It doesn't tell you like why, right? And there could be many reasons why people are. And kind of the story I gave you was, because people are forgetting forgetting some of the expenditures coming down the pike. And when you remind them of it, they become more accurate. But another one could be that partly that is psychologically motivated. It's like it's like a belief-based utility sort of story, I guess is what the behavioral economics models would couch it as, but it's kind of like you're protecting yourself psychologically by not thinking about the horrible things coming down the pike. And by making you think about them, I've like made you super sad. And so, yeah, you've saved more, but you're like kind of miserable, and maybe that's not good for you. And so for us, we just weren't sure. And so we built in some things to try to disentangle between these two things. They're not perfect, they're suggestive. The first one is that we, like I said, like 95% of people are willing to pay us to get this again, to get this intervention again. And so that suggests people who are not trying to avoid thinking about this, or how it makes them miserable to think about like their future problems. And then the other thing is, like, at least in, the way in behavioral economics works, some people have tried to disentangle this is to say, well, if you're kind of lying to yourself because it makes you happier, if I give you enough money to elicit the truth from your mind, you will. But we had like a few different instances when we elicit beliefs to like, we randomize the amount of incentives for being right, and it never does anything for accuracy. So those things sort of suggest it's not that. And then maybe just taking a step back, the hungry season is really miserable. It's like really, really miserable to not have enough food to eat. And it is the biggest problem these guys need to solve in their lives, in terms of like, I have 90% of my income comes in this one lump sum, and I need to get it to stretch until the next harvest. And if you look at just things like child BMI, it looks like a yo-yo. It like dips during the hungry season and goes back up. Like, it is just miserable. And so also just from my gut is just that being able to have more food then. And if you ask people, they're like, yeah, I was kind of wasteful right after harvest. Like, I don't think they're regretting the additional savings.
Yeah, that's really helpful. And also maybe, you could imagine there'd be different results in terms of whether, which wins out in a richer context, in a context where there's
100%.
not extreme poverty. Yeah.
100%. Totally.
I'm going to read this question verbatim because it's not work that I'm familiar with, but I'm really intrigued. So the shape of your findings reminds me of subadditivity from support theory. In that work, Coley and Tversky argued that it's not so much about reminding people of the possibility of each disjunct, but rather it's about their ability to more readily imagine the possibility. Any sense how much it's about reminding people of the category versus shifting their beliefs about the likelihood or plausibility of that expense?
That's so interesting. That's really interesting. I don't know that we have a lot that would distinguish between those two things. because in some sense they both are stemming from a little bit of the underlying it, even the way you've written it. So I'm not familiar with this. I'll look it up after this talk. You know, the way that people are talking about, or sorry, the way like you've written it, even in the about visualizing, it's like I'm prompting you, like I'm giving you something that's now bringing this to mind and is prompting you to visualize that possibility. And I think that could definitely be going on. But both are coming from the fact that like you're not keeping everything you kind of know in some sense top of mind, but I can see the psychological difference.
Interesting to think about ways to distingush that in a
Yeah. I'm like trying to think. I don't have something
version,
I'm
but
gonna think about it. Yeah. It's like good homework for us to think about that.
Totally.
I'm gonna write that down, subactivity theory.
Here's another interesting question about just about the practical implications of the work and whether you might have underestimated them. So one audience member was wondering if the corn prices are smooth or if they perhaps go up during the late part of hungry season, which would mean there's an added benefit for the treatment group.
Yeah, I love this. I love this question because I glossed over it because I didn't want to go over time, but it is true. There's a huge implications for prices because what happens is everybody eats down their maize and they run out faster than they thought they were going to in the hungry season. And now in the hungry season, everyone's going out and buying maize. And so what happens to the price of the maize in the market? It spikes up. And so now, like, for just the same amount of money, you're getting less maize. So it's like the worst possible sort of, kind of cycle. And so in some sense, what's happening is that for when you're a treated person and you are holding more savings, so you're not going and buying more maize in the market, it helps you, but it also helps everybody else by not bidding the price up as much. So in the scale up that we're doing, we're not yet sure if we'll manage to build that part in, but one of the things we hope to do is actually build in a test of this explicitly where, if we can intensively treat some villages and not others, to actually see changes in the price of maize, which would sort of say the psychological feature is like aggregating up to change the entire market. Can we actually make it so the maize prices look more smooth across the year by doing this sort of thing at scale?
Really
That's really intriguing. I think we have time for one more question, depending on the length of your response. So I'm going to pick this one. You hinted at some other applications, like the teachers deciding how many days they should spend on fractions. But this is a question about whether these findings could be applied to decision-making in other venues to avoid like groupthink or to support systemic and critical thinking generally, like at the organizational level or corporate level. Could it, help with fiscal planning, or is that too much of a stretch or a leap from your results?
No, I think it totally, I mean, I think in some sense, the planning fallacy literature has already shown us the relevance of this, right, in those settings. And people have looked and shown that like people run over budget and organizations do that in terms of time, money, and so on. And what the planning fallacy literature has done is shown that if you use these kinds of interventions in those kinds of settings as well, you can get people to have more accurate beliefs. Kind of what we're adding to that is to say those beliefs are consequential. Like when you change people's beliefs in that way, what we did is then we followed them over the whole year and said, look, it has this huge impact on behavior. And so if you were willing to kind of use a transitive property, that would imply that when you do this in corporations or other settings, you could then really change behavior there as well.
That's great. I was so impressed when Katy and Angela were running their series about how promptly they wrapped up. So I'm gonna charge ahead for our wrap up. We're really glad that about 100 people joined us for the seminar. Hope you'll come back. We have an amazing series that Sam has just projected up to see what else is coming in the future. Thank you to Katy and Behavior Change for Good for co-sponsoring the event. And very much thank you to Supreet Kaur for generously sharing this really, really interesting, thought-provoking work. Way more questions from the audience than we had time for today, but really inspired to go forth with that wisdom under our belt. So thank you, everybody. We'll see you back here again for our next seminar. And thanks for joining.